Hi, my name is Laura Reichart, and I'm the director of the Hawaii State Center for Nursing and an adult geriatric primary care nurse practitioner. This module is going to review the COVID-19 resources document for post-acute care facility with a specific emphasis on staffing considerations in a COVID environment. I'd like to start off with some CNE information. The Hawaii State Center for Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. To receive credit for this activity, participants must complete 100% of the activity or watch this entire video, complete a post-test with a minimum 70% score, and complete an evaluation form. The post-test and the evaluation are accessible by one link, and that link is posted underneath the link where you accessed this video on the module information page. All of the disclosure information was also posted on the module information page. And I'd like to note that there were no conflicts of interest identified for individuals involved in the planning or delivery of this learning activity, and that the Healthcare Association of Hawaii and its subsidiary Hawaii Hospital Education and Research Foundation is a joint provider for this activity, and they provided in-kind and financial support for this learning activity. By the end of this presentation, participants will be able to find the repository of COVID-19 resources compiled for post-acute care settings, identify what local and national COVID-19 resources are available to support post-acute care settings in delivering care, and interpret these types, or the types of COVID-19 resources, rather, by their intended use. So let's get started. We're going to review some of the information that you may have seen in Module 1. For a more detailed presentation, please refer back to Module 1, but we are still going to review that information as it's important to know how to access the document before we review what's in the resource document. So where can we find the repository of COVID-19 resources compiled for post-acute care settings? It's primarily located in two locations. The first is the Healthcare Association of Hawaii website, hah.org. And right now it is on the COVID resources for post-acute care notice, which you can see on the front page in that green box to the bottom left. It's also on the Hawaii State Center for Nursing website, hawaiicenterfornursing.org. And you can see it's on the main page under COVID-19 resources for post-acute care. Both of our websites will be updating the document regularly, and both websites have downloadable documents. So when you access the document, if it's more convenient for you to pull it down, save it to your desktop, or print it and share it with others, that is certainly an option that you can have. Let's identify what local and national COVID-19 resources are available as it relates to staffing in a COVID environment. On page, well, it's page 2. It's the second page of the document. You'll see a table of contents. The first page is the title page. Second is a table of contents, and that's what we're looking at here. You can see that under limiting transmissions of infections, which is right here, there's a section called staffing. Let me circle that here. Under staffing, there is both guidance and there's ratios and resources. As a reminder, The order of the resources follows a logical order from federal to local government, professional association, and individual organization. So when you're looking at resources, you can kind of identify which is most pertinent. If you've already seen the federal and state resources and you need some more detailed instruction, that's when I would recommend going to the professional associations or individual organizations. But if you need to review what is being legally allowed at this time or recommended by our governments, both the federal and state governments, then just look at the top of any one list and start your review of information there. Now let's look at the different types of resources by their intended use. So we're going to look specifically at the staffing section because that's our focus of this module, and specifically the documents related to guidance and ratios and resources. Let's take a look at the resource document now. Here we are at the resource document, and I already have this pulled up. If I go, this is the main page. This is the title page of the document, and it has when this document was last updated, a reminder of how the resources appear, and when you'll see the bold items, that's just a reminder that they've been newly added since the prior version. And then on the second page, which is technically page 1 here, this is the table of contents. So let's go down to staffing. We can click on that and it'll take you directly to the staffing page. And let me make this a little bit larger for our ease. Here we have a guidance section and we have a ratios and resources section. In the guidance section, there's information from the Centers for Disease Control and Prevention, that is a federal entity, the American Healthcare Association, a professional organization, NHPCO and NAHC, also professional organizations. And then with ratios and resources, we have the UCSF Health Force Center. They have information related to surge planning, the Health Workforce Technical Assistance Center, and the Society for Post-Acute and Long-Term Care Medicine. And they have updates for the nursing home worker. I've already pulled these resources up. I've opened them, but just as a reminder, in order to access them, all you need to do is click on the link and it should open directly to that resource. Here is the first document that we have identified under the staffing page, and this is under the guidance section. This is criteria to return to work for the healthcare personnel with a suspected or confirmed COVID-19 diagnosis. And this is interim guidance. So I do want to note that in as many instances as possible, this link or the resources link directly to a web page. So if any of the content is being updated, that you have that accessible to you. So this is updated as of April 30th, 2020. The information is for a healthcare provider has symptom-based strategies and test-based strategies, and when to exclude that person from your workforce. So if it's symptom-based, at least 3 days have passed since recovery, defined as resolution of fever without the use of fever-reducing medications, and improvement in respiratory symptoms, and at least 10 days have passed since the symptoms first appeared, or if you're relying on test-based strategies, which are becoming increasingly more available, the resolution of fever, improvement in respiratory symptoms, and negative results of FDA emergency use. There's also guidance for healthcare professionals with laboratory confirmed COVID-19 without symptoms, and we know that there is a sizable population of individuals who may have the virus on board without presenting any symptoms. So there's time-based and there's test-based, both. And you can see that they're pretty similar to the symptomatic-based strategies, except this is related to the start date is the start of the positive COVID diagnostic test. There is a note, and this is important, that detecting viral RNA via PCR does not necessarily mean that an infectious virus is present. This is emerging information because this is an emergent disease. And they've provided work practices and work restrictions once that healthcare professional should return back to work. So wearing a face mask, self-monitoring of symptoms, and then strategies to mitigate healthcare personnel staffing shortages. So they do have this strategies document here that you can review. Let me highlight that for your ease of identification. If you want to go in and look at more of the guidance that they have, it is available to you. However, we have also identified additional resources, and let's look at those now. So the reason we're thinking about staffing is because we know two things. We know that when there is a surge, the workforce demands are greater. We know that you may have to utilize your staff more frequently, but also if somebody does get sick and we have to take them out of the workforce, like this protocol and the CDC recommendations are explained here, then we'll have to think about other personnel and how to get those other personnel to you. So let's continue looking at the guidance here. The American Healthcare Association has information on combating coronavirus, our fight to protect seniors and individuals with disabilities in long-term care. And so the CDC resource recommended the protocol once you have identified suspected or confirmed cases in your employee workforce. This resource from AHCA includes how to screen individuals who enter the building, including staff, and it gives you a checklist for screening, which is really nice. It also provides a template log for personnel in Excel or PDF, whatever most convenient to you, to track employees and the temps or the alternate workforce that you may be using. And it also has information or recommendations on how to contact your local healthcare coalition. In this case, it would be the Healthcare Association of Hawaii or the State Health Department. And it has reporting requirements for confirmed cases, It has a whole section on workforce, so template messaging to staff on social distancing, how to support your healthcare workers if they have dependents, emotional support for your healthcare workers, how to ensure that your temps that you're bringing in have the competencies needed to perform care in your facility, and then also additional information, housekeeping handouts, and information on providing compassionate care to help with that care, help with the safety and sanitation of the facility, and help with the overall approach as it relates to staffing. You can also see that they have a full section here on personal protective equipment. And we also have a list and resources on our resource repository as well. So we have several considerations with staffing, but in terms of monitoring symptoms and planning on or having a plan for when to identify how to take somebody out of the workforce, these first two documents are really great. Finally, in this section, there is a illness tracking form. This form is great. It does not need any additional work on your part. You can just have an employee or the healthcare provider answer these quick questions. You can see it's not too laborious. And they give you guidance. So if there's a yes, provide details. If exposed and experiencing symptoms, what are you going to do? And so this is almost a policy and a screening tool in one. It also notes that there may be state mandates that supersede these guidelines. So while this may be a rule of thumb, we may have more strict rules in our state depending on the severity of the outbreak that we may be occurring at any one point in time. And as we have learned, we can plan for the worst and have great mitigation strategies. In other states, they've planned for the worst and they've experienced the worst. So we really have to pay attention to the news and the proclamations from our governor and from our mayors. But in the meantime, we do have resources that are available to us when we need them and when we need to implement these safety strategies. Okay. The next document is shared by NAHC, and this is Home Care Industry Coronavirus Employer Frequently Asked Questions. So this is nice in terms of considering HIPAA, ADA considerations, leaves of absences, compensation, etc. So if you have employees in your organization, this may be a really helpful resource to you in planning how to protect your residents or your patients, as well as protecting your workforce. And as you can see, they have long guidance, so it's not always a straightforward or an easy answer, but they are doing their best to provide information and guidance that is applicable and usable to organizations or entities that are performing home care. These next few documents relate more towards workforce staffing strategies, how to create a plan for your workforce needs based off of reallocation of staff to patient or resident ratios, and also communicating with your staff related to the risks. The first resource we're going to be looking at is from the Health Force Center, at UCSF. And let me make this a little bit larger. I'd like to focus here on the workforce and staffing section. Though these resources are focused on acute care hospitals, they do have some nice applications to long-term care, home health, etc. So we can make some assumptions or look at the strategies that they've applied for acute care and see if we can relate them to post-acute care. I'd actually like to focus on the health workforce baseline and surge ratio document, and we have included this directly into the resource repository. The health workforce baseline and surge ratio document is created for the intensive care and the hospital-based settings, And they do know, the creators of this document do know that it's not an exact science. They've done their best to create estimates, and that they have not taken in existing state laws into this document. There are some states that have nurse to patient ratios, and so they're not looking at legal restraints. They're looking at capability of these different team members. If we look at the top of the document here, the row in blue, excuse me, you can see it's organized by team member, baseline ratio from the minimum to maximum, and then surge ratio, minimum to maximum, and they have notes. Let's scroll down to the certified nursing assistant role. So in a baseline or normal situation, you may have 7 up to 17 patients or residents assigned per CNA. And in the surge, they're saying that you may have 10 up to 15. So they're saying there may be more patients assigned per CNA, but they're not recommending as many patients assigned to a CNA as a normal environment. And they also note that if the licensed nurse ratio is fewer patients, then there may be some room for the CNA to take care of more patients. And then the inverse is true. If the licensed nurse ratio is seeing more patients, then they may need more hands-on help from the CNA. You can look at this document in another way. So we're looking at it in terms of potential increase in increases in the number of patients or residents that a CNA or any one of the team members is caring for. But we can also say, well, what if we are cohorting our units and we have 17 COVID patients on the COVID floor? But I normally assign a CNA to 17 patients, and right now it's a surge, and I'm only going to assign 10. Well, then you might need to bring a second CNA onto that unit for every shift. And this gives you an opportunity to plan. So now you need 2 CNAs per 17 patients or residents. And you can then adjust your numbers of your staffing calculations and look at the overall demand for a week, for instance, or for a month. And you can say, oh, well, I have 100 CNAs in my on my staff, and I have needs for 80, so I have 20 spare. So if I have some CNAs who become sick or have to take leaves from work for whatever reason, I still have 20 to pull from. Now, if you don't have that extra room and you say, gosh, I'm gonna need to plan for what to do, then there's some great opportunities here. One is you can figure out a ballpark number, and then you can say, well, I'm gonna need to hire. So go through your normal staffing plans. I'm gonna need to hire. So I'm gonna put out a call for more CNAs. And then after you've exhausted the applicant pool and hired everybody who's eligible and would be a good fit for your organization, you can say, what do I have more? I haven't made enough. If you haven't made enough, you can reach out to the Medical Reserve Corps. That is a Hawaii Department of Health resource, and you can communicate to the Medical Reserve Corps your additional needs, and they can provide volunteers for you in the event that you need them. Or you can reach out to the Hawaii Healthcare Emergency Management team, and that is an entity of the Healthcare Association of Hawaii. And as their name implies, they specifically work on healthcare emergency management planning and strategy, and they have a strategy for surge capacity and allocation of resources, including personnel. So then you can start to plan and say, this is what this is the worst case scenario, this is my plan, and you can start to communicate that in advance. And so if in the event you do need additional people, you know who to communicate to and how, how to communicate to them. What numbers do you need? What types of workforce or what type of personnel or roles you may be needing. This next page might help you with those plans. The Health Workforce Technical Assistance Center has a number of resources related to search capacity strategies, health workforce policies and guidelines, workforce safety, etc. This organization is a network of workforce centers, and so they cull really great resources from across the nation, and they often have posts and articles about the experiences related to workforce planning. And so you can read these articles or look at these resources and figure out how to apply them to your organization. And then lastly, we have the Society for Post-Acute and Long-Term Care Medicine. So this is a really great communication to staff. And even though it says for nursing home workers, I think it could be applied to other settings in post-acute care. So how do you protect yourself? Should I come into work? What do I do if I was possibly exposed? How sick will I get? So these are really important questions. And as we mentioned with in the cohorting module, the more people have quality information, the more empowered they feel, and that can also help decrease a sense of anxiety. So this is really important, not just for planning, but also for well-being of your staff. There's a great table they've included, so you can have a conversation with your employees or your colleagues about age and risk. And it's important to note that even for the oldest population, most people recover from COVID, especially when they are healthy, as the take-home lesson notes. But it also creates an opportunity to have meaningful conversations. You can give this document to your employees or your colleagues, and then have a conversation afterwards and say, after you looked at this, do you feel like you still have risk? Are you feeling more comfortable? If, let's say, you're in the 65 to 74 population, or the person you may be talking to, and they say, I understand that 96 out of 100 people will recover, but I happen to have some health considerations, and that makes me concerned. The opportunity then is to say, well, are there other roles that we can put this person in, take them maybe out of a CNA role and into a phone triage role or a non-direct patient care role, so you can remove their risk. But then, going back to the example of having 100 nurses or CNAs and only needing 80, then you may say, oh, well, I actually, after these conversations, I now realize I have 10 people that I'm going to need to reassign. So I only have a buffer of 10, and I might want to make plans in case I need an additional 10 individuals to help with the CNA role. So this would allow for a improved sense of well-being and communication and trust, but it also helps with workforce planning by opening the door to a meaningful conversation about risk and how to reassign based off relative risk. Now, if we go back to the document, I do want to note that this document will be updated. And so these are the resources we have today, but there will be more resources as we identify them. And we hope to improve every section in here or add to sections. So please also remember to check back frequently in case there are new resources that we have identified from across our nation and also other countries as it's applicable to these topics, and see if they're meaningful to you. That's the end of Module 2, which focuses on staffing. Thank you so much for your engagement. I want to remind you of the next steps. Please be sure to take the final quiz and evaluation. These are requirements to receive continuing nursing education credits. The quiz and link evaluation, which is a single link, is located below the link that you clicked on to watch this video on the module page. And please also subscribe to the Hawaii State Center for Nursing newsletter for more information about upcoming events and continuing nursing education activities that we provide by registering at bit.ly/HSCN news, NEWS. Thank you so much.